Okay, well, let's make a start. Hello and welcome to today's HealthInfoNet webinar. Before we begin, we'd like to acknowledge the traditional custodians of the land on which we're standing, the Whadjuk Noongar people, and pay our respects to elders past, present and emerging. Thanks for joining us as we explore how the iHealth portal can help you. The webinar is intended to give you a practical guide to finding information and sharing your knowledge about Aboriginal and Torres Strait Islander iHealth on the HealthInfoNet website. My name's Trish Amaranti and I'm joined today with my co-presenter Sam Burrows, and we're supported with Millie Hartman-Mills with our technical side of things. The webinar is going to be recorded and we'll be presenting for about 20 to 30 minutes, and at the end of the presentation there'll be about a 10 to 15 minutes for questions. I'm going to hand you over now to Sam, who's going to give you an overview of what we'll be covering in the webinar.
Hi everyone, and thanks for joining us. Through the webinar today, we hope to enhance your knowledge of the HealthInfoNet website generally, provide an overview of the iHealth portal more specifically, and demonstrate how you can use the portal to support you in your work, and also touch briefly on the range of knowledge exchange products and social media platforms that you can use to stay connected both with us and others in the iHealth sector, and to stay abreast of the latest information about Aboriginal and Torres Strait Islander iHealth. So the main purpose of the webinar is to demonstrate how the iHealth portal can help support your work, both through providing access to relevant, timely, credible research and evidence and information and resources, and also by the work that we do around summarising and synthesising that evidence in order to make it more accessible and visually engaging to people working in the iHealth sector. So we're now going to switch off the webcam and go live to the HealthInfoNet website. But before we take you on that tour through the website, Trish is going to tell you a bit more about the HealthInfoNet.
Great. Okay, I'm going to tell you a little bit about the HealthInfoNet. It was first established in 1997 by the late Professor Neil Thompson to take advantage of the internet for sharing information about Aboriginal and Torres Strait Islander health. The HealthInfoNet aims to provide the evidence base to support health workers in their practice and to assist policymakers in their decision making. It also aims to help academics, students and the general public keep up to date with new information and research. The HealthInfoNet has recently launched a new responsive design website to support the workforce more than ever before, on any platform and in any location. Today's webinar has been made possible by the Fred Hollows Foundation, Edith Cowan University, the Australian Government Department of Health, and of course the Australian Indigenous HealthInfoNet. We'd like to thank the Fred Hollows Foundation, particularly the staff in the Indigenous Australia program, for the opportunity to be here today and for their support in the development of the iHealth portal. Sam's now going to introduce some of the key resources that are available from the HealthInfoNet homepage.
So hello again and welcome to the new homepage of the Australian Indigenous HealthInfoNet. For those who maybe haven't seen the new look, the website was launched earlier this year in May. So if you haven't been online since then, you may find it looks a bit different. And I'm just going to talk you quickly through some of the changes that have been made. So when you open the homepage, the first thing you'll notice is some of our latest information, which is in the feature bar. So you'll see at the moment, most recently launched has been our plain language summary about Aboriginal and Torres Strait Islander health. We've also launched a new palliative care portal and a new climate change section in our environmental health portal. We've tried to improve the functionality and ease of access to all of our content, and you can do that from the navigation bar at the top of the home page, where you'll find 4 navigation buttons. The first one, Learn, provides access to the vast majority of our content. So there you will find key health facts, information about a whole range of health topics, including immediate access to our iHealth portal, information about cultural ways, but also the determinants of health, including the social and cultural determinants of health, information about different aspects of our health system, and information organised by population group. Finally, we've also organised that information by state and territory if you prefer to access it that way. The practice button breaks down the information into types of information, specifically publications, policy documents, health promotion and practice resources, program information and organisations, and you'll also find the workforce information that we provide, particularly around details around courses, events, conferences, funding and jobs. From this section, you can also access our dedicated section for Aboriginal and Torres Strait Islander health workers and health practitioners. The About button at the navigation bar at the top gives you access to all of the usual information about our mission, who we are, who we work with, our advisory board and consultants and funders. Finally, if you need to contact us, just do that through the contact button where you'll find our contact details, but also an online form that you can send to us directly. So if we scroll down the home page, and you'll find in our first banner a search bar. Now this search bar is a new feature to the HealthInfoNet website because it allows you to search not only across the website but more specifically across our database, which provides access to all of our publications and resources and also our program information and that kind of content. So if you are stuck for where to start, and obviously it's a huge website, that's a good place to begin. Just type in your search terms there and see what it brings up. But moving down, I'd just like to mention the art gallery that's been created to showcase the beautiful pieces of art that are featured across our website. We're very fortunate to have those. They've been created by Aboriginal and Torres Strait Islander artists from across the country. And if you click on any of those thumbnails, you can see the art piece in full. Scrolling down further, again, a range of different ways to access the information. So you'll find our key resources, breaks down the information by publication. You'll see that we have almost 27,000 publications in our database, and wherever possible and wherever they're available online, we give you access to those. We have almost 3,000 policy documents, 4,000 health promotion resources and practice guidelines, information about more than 3,000 programs and about 1,500 organisations working in the Aboriginal and Torres Strait Islander health sector. Again, workforce information is broken down into events, particularly conferences, courses, funding and jobs. Scrolling further down the home page, you'll be able to access a few of the websites that have been developed by the HealthInfoNet and are maintained by them, but sit outside the HealthInfoNet website itself. And they include our online journal, the Health Bulletin, and also our separate website dedicated to all information around alcohol and other drugs. Scrolling down further again, you have access to the portals within the HealthInfoNet website. This is another very easy way to get direct access to the iHealth portal. Finally, down the bottom, we have a range of knowledge exchange tools and social media platforms, including newsletters, Twitter, and yarning places. And we'll be able to talk more about those later in the webinar as we discuss the ones that are specific to the iHealth portal. So that gives you a brief overview of the kind of information you can access through the homepage. Trish is now going to give you some information about the history of the iHealth section itself.
Great, thanks, Sam. I'm going to go back up here and just click into the iHealth portal. The iHealth portal was originally developed between the mid-2011 and mid-2014 with funding from the Office of Aboriginal and Torres Strait Islander Health. Its development was guided by a national referendum group comprised of practitioners and researchers working in the field of Aboriginal and Torres Strait Islander eye health. The portal was developed in response to the findings from the 2008 National Indigenous Eye Health Survey that demonstrated the disproportionate burden of eye disease faced by Aboriginal and Torres Strait Islander people compared with non-Indigenous people. While Aboriginal and Torres Strait Islander children, especially children living in remote areas, often have better eyesight than non-Indigenous children, Aboriginal and Torres Strait Islander adults, unfortunately, are at greater risk of vision loss and blindness than any other Australians. However, the good news is that almost all of the eye problems experienced by Aboriginal and Torres Strait Islander people are either preventable or treatable. And there is positive signs that the eye health initiatives are closing the vision gap. Since mid-2014, the HealthInfoNet has continued to add eye health publications and resources to the portal. But it was not until September 2016, with the support from Fred Hollows Foundation, that we've been able to systematically expand the content of the eye health portal, support knowledge exchange functions to assist the eye health workforce, and begin to promote the portal. So let's have a look at the eye health portal in more detail.
Thanks, Trish. First, I'd like to mention and acknowledge the beautiful piece of art that we have in the banner at the top of the Eye Health Portal homepage. It's by Julie Weeks, whose family hail from the Torres Strait, and we're fortunate to be able to present that artwork on our website with permission from the ECU Art Collection. So, like the HealthInfoNet homepage itself, the information that is structured on the Eye Health portal is broken down in a similar way. One of the easiest ways to access that information is to go to the orange navigation bar where it says Eye Health. And from there you will see that we have broken the portal down into a range of specific subtopics, including information about eye and vision, examining the eye, vision loss and blindness, and the four main conditions affecting Aboriginal and Torres Strait Islander people, which are refractive error, cataract, diabetic retinopathy, and trachoma. Similarly, the information can be accessed by information type, so you can go directly to publications if you're after a journal article or a report. If you want to see the latest policy documents, it's straight into policies, etc. So resources, programs and organisations. Similarly, the workforce information that is specific to eye health is broken down into events, courses, funding and jobs. If you don't choose to use that pull-down menu, you can see all of our specific subtopics appear on the right-hand side of the page. And they are the same subtopics that appeared in your pull-down menu from the orange nav bar. Scrolling down, you see our featured knowledge exchange products, and at the moment those that are featured there are about diabetic retinopathy, and they've been co-designed with collaboration and support from the Fred Hollows Foundation, and we'll tell you a bit more about those later in the webinar. Scrolling further down the homepage, again another way to access all the same information. This identifies that currently we have about 730 publications, which include journal articles, conference papers, reports, etc. 53 policies that are specific to eye health or related topics. In the case of resources, you're looking at 160 or more health promotion and practice resources. We have information about 85 programs that are addressing eye health within Aboriginal and Torres Strait Islander communities, and 50 organisations that are working in that space. Again, information that for conferences, courses, funding and jobs can all be accessed from that part of the homepage as well. So there are multiple access points, and it really comes down to personal preference as to what you prefer to use to access the information you're after. So I think that brings us to the end of the quick discussion of the Eye Health homepage. We're going to talk quickly about publications and give you a specific example of the kind of information that you will find when you click into that section. So you can see the buttons along the top of the page are broken down by subtopic. So say, for example, you wanted to find information about diabetic retinopathy. You can see that you can click straight into there, of which there are items about diabetic retinopathy in the vicinity of 147 of those, and they range across those different information types from journal articles to electronic sources, even conference posters, etc. The filter is a new feature that's been added to the website since it has been launched, and it allows you to use different criteria to search for the information that you're after. So say we want to find some of the latest stats around diabetic retinopathy within Aboriginal and Torres Strait Islander communities. Let's have a look at some national stats. We can select that location and we'll try the journal articles. That'll show that there are 10 records that fit those criteria. The most recent one is listed at the top. It's a journal article from 2018, and it documents all of the information about diabetic retinopathy from the National Eye Health Survey. So in this case, it's looking broadly at the range of prevalence and causes of vision impairment and blindness in Australia. You'll find the title to the resource, the author details, the full citation, and wherever available, links to the online information. So in this case, if you were to click on the abstract link, that would take you directly to that online source, which sits outside our website. And we're loading that now. We'll just close that advertisement, one of the issues with the internet, and that'll show you the abstract. And if it's available in full text, you will have access to that as well. That may not always be the case. We can't provide that access. It will depend on how you're accessing that information from your end. So that gives you an idea of how the information is structured around publications. Trish is now going to tell you a bit more about the information we provide around programs, projects and resources, and explain those filter buttons in a bit more detail.
Okay, so we're back to the iHealth homepage, and I'm just going to scroll down and go into programs here, and we've got 85 entries. So, for example, if you were looking for a program that was Indigenous specific and projects that are currently connected in the Northern Territory, you can select the following boxes in the filter. So I'm just going to go into here. You can see we've got content type, focus, location, and we also have a thing for remoteness. So I'm in here, I'm going to just click on the Indigenous specific and onto Northern Territory. I've got 10 records to view, and I'm going to bring them up. And the one that I want to have a little look at is a Fred Hollows one, which is called the Community-Based Workers Project. It's current. So I'm clicking into there and brings up the project page. You can see all our pages are pretty much the same. We all have the heading at the top. We've got the focus, the state, the funding, and the status there. We don't have any date specific on this one. There's our description. Here's our contact details. They'll always be included in programs. And underneath are our links that take us back to the actual program information and any other relevant information that's linked to it. In this particular case, we've got some related publications. So if I click onto this one here, it's an evaluation of the program, and it's actually going to take us to another page within our website that tells us more about the actual publication itself there. So you'll often find publications linked to programs in this way. Let's go back to the actual program, and I'm going to move on from there, but I just wanted to remind you, if you have programs or you're currently working on a program that you think should be included in our website, please check to see if we've got the latest details. If the contact details of any of our programs have been changed since we've added the information to the website, or if new information is relevant, please don't hesitate to contact us so we can update our pages or even add new entries, because we actually rely on you to tell us, our users to tell us the latest information, and that's what's happening out there on the coal front. So the next one I want to have a little look at is resources. So back to iHealth homepage, And I'm going to go back down to the easiest way for me to get down to it is to our resources. Clicking on here. And our resources are separated into two different lots of resources. We have health promotional resources, which are designed to raise awareness and assist in community health education. And only resources from 2010 are included in the iHealth portal, although older resources are available and can be found by searching on our full health promotion resource database. Our other sort of resources are the health practice resources, which we'll have a little look at in a moment. Now, to have a look for resources, you can click onto the filter and you can see here that we've got content type, focus, location, and the document type. And if you click on either one of those, and that just brings up whatever that you're looking for. In this particular case, I don't particularly need to look at that one because I'm going to collapse that box, which is over there. And I really want to show you the latest Fred Hollows, or one of the latest Fred Hollows resources that we've got. All our resources are listed by the latest available or newly published. But if you go over here to this little box over here and click down, you can also either have newly listed. If you're looking for anything in particular from a particular year, you can do it from the year published, the title, or the author. In this case, let's have a look at this one by Fred Hollows. Australians like Winston don't need to be blind. So here it comes up, same sort of format again, published in 2018. There's the title, author, the publisher. We've got a citation from it. We also have the contact details. And in this case, we have links. This one's been hosted on YouTube. We're not going to click into it, but sometimes you'll find that resources don't have links anymore, but you still are able to have the contact details to get in touch with whoever's published it. Okay, let's go back and have a look at the health practice resources. And in health practice resources, you can filter by guidelines, clinical guidelines, manuals, and administrative guidelines. Now, health practice resources are designed to support health workers in their practice. So by going through to these ones here, you can look for whatever sort of resource that you need in guidelines. You can also have an Indigenous specific or includes Indigenous information, but we also have an area for total population, because quite often resources for training and upskilling are often for total population. You can also obviously have location, and once again you can have your document type. So in this case, I am going to have a little look at an entry called, now I'm just wondering what I'm doing here, an entry called the National Guide to Preventative Health for Torres Strait Islander people, Aboriginal and Torres Strait Islander people. So I'm just going to click into that one there. It's a report that was published in 2018. Once again, it's got the title, author and institute, citation, and information about that. Down the bottom there, it's got the contact details, and it has a little snapshot of the particular links to it. Okay, this report was produced by the National Aboriginal Community Controlled Health Organisation and the Royal Australian College of General Practitioners in 2018. It's got a brief publication and, as I said, the contact details. Okay, let's go back and have a look at the workforce area now. So I'm going to click back into the actual home page, take you down to the bottom again, and we're going to look at the workforce information. We've got events, we've got courses, funding, and at the moment only one job available for iHealth workers. If I click into courses, It brings up the list of courses there, which obviously you can again use the filters, and it shows you that the content type. You've got online modules, short courses, postgraduate courses, and undergraduate courses, and of course the locations for those. In this case, I am going to have a look at this one here, the Australian Aboriginal Child Health module. It's an online module. It gives you that information here next to the title. Now, how this differs from other entries like a program entry is that it also tells you the target audience, the sort of delivery mode, and whether or not there's a fee payable. Down the bottom, it takes you back to the organisations that are actually running the courses, because of course we don't run them through the HealthInfoNet. Okay, I'm going to hand you back now to Sam, who's going to take you through to the share with you the latest information about the co-designed diabetic retinopathy resources, and she's going to explain a little bit more about those.
Thanks, Trish. So for a couple of years now, we've been really fortunate to be able to work closely with the Indigenous Australia program at the Fred Hollows Foundation. And it is with their support and collaboration that we've developed a series of multimedia resources about diabetic retinopathy, which you can access by scrolling down on the iHealth portal homepage to our Knowledge Exchange products. So these resources have been designed specifically for Aboriginal and Torres Strait Islander health workers and practitioners working in remote communities, but we anticipate that they will be relevant to others working in the eye health sector. They were developed to coincide with the rollout of the DR screening cameras, and that program is still underway, and the resources have been used in the training associated with that program. The resources summarise the latest information about diabetic retinopathy and new initiatives in the diabetic retinopathy space, where people and organisations are addressing Aboriginal and Torres Strait Islander eye health, including the relatively recent MBS item 12325 for DR screening. So the resources have been developed in different formats to meet the different learning styles and information needs of our various audiences. We have, for example, a 4-page key fact sheet, but we also have a 1-page static infographic which distills all of the key messages from that fact sheet into 1 page. And anecdotally, we know that these kind of resources are being used, for example, by Lions Eye Institute, who takes them out with them when they go on the vision van into remote areas of WA and leaves them with AMSs out there. So we also, in addition to the infographic, we also have another series of products in that suite of resources. They include a short video or animated infographic, which is about 4 minutes in length. And again, that video is now sitting on the HitNet community hubs that are available across the country, as well as being used in the rollout of the DR screening. And we have a PowerPoint presentation as well, so that people who are providing health education or training can draw on slides available from that presentation to develop their own training initiatives. I'd like to just mention quickly that we are in the process of evaluating those resources with the Fred Hollows Foundation to understand where and how they're being used and what we can do differently and potentially better next time we create a series of resources like these ones. So if you have seen or used these products and would be interested in providing feedback about them, we'd love you to get in touch with us. My details will be available on the slide at the end of this webinar, but if you contact the HealthInfoNet through the contact form, you'll reach me that way as well. So finally, we'd like to show you quickly how you can stay connected and stay across all the latest information through our knowledge exchange tools, specifically the iHealth newsletter. And we have an example here for you. This one was for the month of October and it was released earlier this month. What we do is we compile a range of information from a range of sources that we've come across in the last month and provide links to those in the newsletter. So that newsletter, if you subscribe, is sent to your email inbox about once a month, and from there you can link directly to those sources of information, which include everything from news items through to journal articles and reports, new resources, information about courses and training, and upcoming events and conferences. In addition to the newsletter, and if you click on the newsletter here, this will just demonstrate how you subscribe. So it's simply a matter of putting in your name and email address. There are other newsletters about other health topics. You can choose to receive those as well, or you can go simply into the newsletter archives to access the newsletters that have been published to date. In addition to the newsletter, we have our Twitter account. So if you prefer to use Twitter, and we found that a lot of people working in the eye health sector do use Twitter very, very effectively to distribute information about the work that they're doing and various initiatives. So we compile all of that information. We provide tweets not only about our own work, but wherever possible, we retweet the work that is underway and that organisations and individuals are involved in across the country addressing eye health with Aboriginal and Torres Strait Islander people. And we currently have 900 followers, or a bit more, I think, 946. So yeah, great way to connect and link up with others working in the eye health sector. Finally, we do have a yarning place, which is a dedicated online community of practice where you will find features like a yarning board where information is posted, the list of members, currently we have 156, and information about events is also provided on this platform. But do stay tuned and watch this space, because we are in the process of overhauling this particular platform, and we will be bringing it up to speed with the latest technology and new ways to deliver information and share knowledge across the sector in the future. So I think that covers it largely for me. I'll hand over to Trish to wrap up.
Okay, well, we're going to bring up our contact details now. And so if you do want to get in contact with us, it's coming up now, and there's all the information. So you can check out our resources here, particularly the diabetic retinopathy resources. You can visit the eye health portal here at this address, and the best person to contact is probably Sam, who runs the eye health topic area on our website. But if you can't get hold of Sam, you can also contact us through just through our HealthInfoNet website and our HealthInfoNet email or our telephone.
So thank you very much for your time and participating, and don't hesitate to get in touch.
Yeah, we hope you found this useful, and that you'll come back and visit our site again, and we look forward to hearing from you if you'd like to send us any information about any resources or programs that you might be working on yourself at the moment and feel that should be on our website. Great, thank you very much for joining us.